Good morning. See if I can. Okay. It's my privilege to be here with the distinguished panel today. This is my fifth visit to various conferences in India, and I must tell you, every time I come, I get more excited, and I go back with the enthusiasm. In my short remarks, I will cover three things. I'll tell you a little bit about United Health Group. It's primarily a U.S. company, although we have a footprint in India as well, that I'll touch it. Then we want to talk about, as Pankaj mentioned, at a little bit higher level, what is really at stake is access to health care in an affordable way. And this is true globally, not only in the United States, but anywhere in the world. And then we will talk about how do you provide the continuum of care and focus on a person as well as the population management. If you are, as an insurance company, if you are managing a large population, how do you provide that? And then I will end with a few innovation that we do it ourselves or through partners, and give you one example in the diabetes prevention and control area. So a little bit about United Health Group. It's a Fortune 25 health and well-being company. Most of the folks in the U.S. recognize us on the left side, where we have about 75 million, nearly 1 in 5 Americans is insured. And they come from a variety of ages as well as their demographics. So we have employer-sponsored health insurance program. We have policies that individual can purchase. We have people over 65, we call Medicare and retirement. So this is funded through CMS. We also have community and state funding. Each state had their own healthcare program called Medicaid in the U.S. And then we also serve military and veterans. So this is the makeup of about 75 million we serve. On the right side is another group that has now is been folded under one brand called Optum, and we have Optum Health, Optum Insight, and also Optum RX. Now here we are delivering healthcare. We have about 10,000 doctors and nurses and nurse practitioners in our own payroll, and we have relationship in the U.S. Over 650,000 healthcare providers, primarily to reimbursing them for the service we do, but now increasingly we are looking at and leveraging that relationship. And what you're seeing in the bottom is the core competency we have. I think we are in a unique position. Not only we have very strong IT, so that when we go partner with other partners, we understand the IT ourselves, as well as we are in healthcare. That's our business, is healthcare. So this is about United Health Group. I must also mention in India, we have a footprint. We have R&D resources located in Gurgaon as well as in Hyderabad. And right here in Mumbai, we have United Healthcare India, which is the commercial arm of the company. So as we are looking at, my focus is what can we do to the emerging Indian market as far as making the difference. So a little bit about setting the stage for access and affordability. The changes going on from the government, the consumer are demanding more access. The care providers, they also looking at how can I access in an effective way. And the sponsor and government are also concerned about the cost and accountability, who's going to be accountable. So the theme is overall, if we can focus on providing access to healthcare to everyone and in an affordable way. So as a company, we have three major areas that we try to focus on. One, and people use different names here, one is we want to help people stay healthy. So this is where you have prevention and wellness programs. And so we are very, very active. We have individual wellness program as well as an enterprise level. And so this is one area. Then some of the members, when they get sick, this is mostly the acute episode they're getting, and we are very much interested in trying to help them get healthy as quickly as possible. So this is where early diagnosis, as well as evidence-based disease management and treatment. Now, then you still have people who have lifelong diseases, chronic diseases, as well as end of life. There, our focus is we want to help people live with the illness and still get the most productive lifestyle they can get. So, the way we look at the value proposition is optimum clinical outcomes and health status, at the same time, efficient use of resources. So that's how we're addressing those. So the other part that we are looking at, Pankaj mentioned, we are very focused on the stakeholders, and that helps us put in perspective a unique and individual innovation, and we do some of the innovation ourselves and partner with us. But in terms of telehealth 2.0, in terms of growth, we are looking at, so what you have in the center, if you're looking at total insured population, you have members looking wellness and prevention, chronic disease, behavioral health, acute care, post-acute, and aging in place. But then we have, these are the different stakeholders. Patient have to be convinced by this method of treatment. They have to trust that's the best available to them, and they're going to get better. Too often on the left bottom is the caregiver in the community. Very often we ignore them. This is I'm talking about unpaid caregivers, the spouses and the parents and the sons and daughters. Now they have to not only manage their loved one, but they almost, sometimes we call it sandwich generation. They have their own kids and they have parents. And we pay a lot of attention. How can we give them peace of mind? Especially for chronic disease, it's not a one event, you hospitalize and then you don't know where we're going. Then on the right side, payer, which could be government or insurance company, they're looking at, yes, of course, cost, but tying more and more with the quality indicators. CMS has published the quality indicators. One must be compared with these meaningful outcome quality indicators. And then in the bottom, I put for you is the provider. Here we are looking at the workflow for the physician or the healthcare provider, and so we have to address with them as well. So, so that's the continuum of care we talked about. I just want to mention a couple of innovations, the solutions we have done where we are putting through this stakeholder analysis, and that's coming in. One doc GPS is the member can search the physician, and granted, it's not the unique for us, but we are serving our own members. We have mobile, My UHC, we have Optimize Me, and also eSync platform where we are able to provide the mobile device as well as total population. So I want to leave you with the last slide is, okay, how do you go into larger scale? Too often, including myself in my previous life, we will develop a telehealth solution that is narrowly fitting in one part that we want to show. As a company where we have large population, we are interested both sides, the pre-diabetes as well as diabetes program. The solution will be different, but if we are member-centric, some of the statistics you heard yesterday globally were a large number. 79 million people are pre-diabetic in the US and growing. 26 million have diabetes. So the programs that we are looking at a large scale, and again, the constituent member, as I showed you before, some are employer-based, some are government-based. These programs have to fit in to the largest number of population. And so what we're doing on the prevention side, we are focusing on obesity and inactivity. And on the prevention side, so remember, this is type 2 diabetes. We heard yesterday from Alaire, they are coming out, it's going to be fantastic. A simple to use, low cost hemoglobin A1C. That's the kind of test people need for type 2 diabetes, not perk their finger 3-4 times because they're not insulin dependent. So with that, I'm going to stop and we'll come back for questions.
Thank you.